Hey everybody, my name is Ryan Cedermark. I'm a nurse practitioner and a chiropractor in Atlanta, Georgia, and Dr. Schmo asked me to present on traumatic brain injury, functional medicine, and the gut-brain axis. So I'm really excited to talk about this because I've had some experience with this in the past with patients, and one patient in particular that got me really interested in this topic was a young girl who had suffered a few concussions in the past, and she was able to deal with those concussions pretty well. But one concussion really kind of basically just put her out of commission. And what ended up happening with her was she lost the ability to eat. So it got to a point where she couldn't tolerate food anymore, and her nervous system was just completely out of sync and out of whack to a point where she couldn't swallow food. If she tried to eat, she would get really sick. Sometimes she would get violently ill and throw up. And so when she came to see me, I was really, no concussion is the same. So I was kind of like, what the heck do I do with this? But I started looking at the research and just trying to figure out what could really happen if the brain gets injured to the rest of the body, especially the gut. Because I always was looking before just at the brain, but understanding the connection between the brain and the gut can actually make a huge difference in patient outcomes. And for her, it really did, because we were able to figure out some areas that weren't working well and then do some therapies to rehab those areas within a short time frame. And she was able to eat again, and she's still eating to this day. She was out of work. Now she's back to work because she has energy, because the food that we eat gives us energy. And she actually just texted me a few weeks ago, and she had a baby. So that's always cool too. But this is a cool topic, and I won't take too much time up discussing all the intricacies of it, but I just want everyone to kind of get an overview and just become familiar with the whole neuroimmune brain gut brain axis, and then some simple things that we can do to make our brain and bodies better after a traumatic brain injury or a concussion. So before we go any further, we have to talk a little bit about the barriers. And our system is built with barriers to protect us. We have our skin barrier to protect us from the external environment. We have our lung barrier so that when we breathe in, we hopefully don't breathe in too many toxins and things get filtered. But then we also have what's called the blood-brain barrier, which is up in the brain, and we have the gut barrier. And those two barriers are very important, especially when we talk about traumatic brain injury, because they can be negatively impacted with any type of head trauma. So just to kind of talk about the intestinal barrier function, this one, what the research really shows is that it's kind of the first area regarding food that comes into contact with the external environment. So if there is a breakdown in this barrier, in the intestinal lining or in the gut barrier, you can get what's called leaky gut, which people may have heard of. But this barrier in particular, it kind of takes a beating because we sometimes put foods into our system that our body doesn't like, and the barrier has to stay intact so that bad things don't get into our bloodstream. But it's a single cell layer that constitutes the largest and most important barrier against the external environment. There's big protein networks, and what we'll talk about in a second are what are called tight junctions. Just think of tight junctions as little zippers, and what they do is they kind of zip up cells so that things can't pass through. When the cells become unzipped or we lose our tight junction integrity, there's a separation between cells, and little molecules can kind of dribble through those not so tight junctions. So we've got the intestinal barrier, and then we've got the blood-brain barrier. And they look a little bit different anatomically, but they kind of serve similar purposes. The blood-brain barrier is different in the sense that it keeps our brain protected from the rest of our internal environment, which may sound crazy, but this is a very selective barrier, and it only allows specific things to go into the brain. So you can imagine that if we have a breakdown or a loss of those tight junctions and stuff starts to sneak into the brain, we can have a really bad pathogenic response in the brain. We can have a bad inflammatory response in the brain. So basically, the reason I'm saying this, and one way to kind of think about this, is Imagine sitting on a nice screened in porch on a sunny, bright day. You're drinking your favorite drink, lemonade, a cocktail, whatever, but you're just enjoying the cool breeze. Maybe reading your book, checking up with your friends on Instagram, or watching the football game on your awesome outdoor TV. But then all of a sudden, and that's all thanks to the awesome screened in porch that you have. All of a sudden, though, there's a hole in your screened in porch and a fly gets in, right? But not just one fly, another fly, and then another fly, and another fly. And all these flies start flying in, and they're kind of disrupting that awesome time that you're having on your screened in porch. So I want you to think about the barrier systems in your body the same way. When everything's intact, so when that screen is intact on the screened in porch, no flies can get in. When your tight junctions are intact in your gut and in your brain, nothing can get past those. So you can't get what's called leaky gut, or you can't get what's called leaky brain. And you can enjoy your lemonade. You know what's funny though is like the flies always figure out a way to get in, but they can never figure out how to get out. It's like, come on, guys, get out of here. So just to kind of give you an idea of what these look like anatomically, they look a little bit different. On the left of the screen here, this is the intestinal barrier. So there's just, it's a single cell layer. It's pretty cool. And, you know, I won't go too much into the neuroimmune component. I'm sure Dr. Yannick told you guys a ton about neuroimmunity and brain injury. But when you have a healthy functioning immune system, things are just balanced out. When you have loss of tight junction integrity, which you'll see in a minute, or you start to see that there's opening up between these tight junctions or zippers, ugly critters can get in and cause a whole host of nasty immune responses. This is what the blood-brain barrier looks like. I like to think of it as kind of like overlapping hands, right? So it looks a little bit different. You've got these what are called astrocytes, these big green things with these kind of big hands that kind of just cover over each other, and they create what's called, well, they help kind of increase the integrity of the blood-brain barrier, but then you also have tight junctions, which help close up what's called the endothelial cell. So they look a little bit different, but they're very similar mechanisms. One's in the gut, one's in the brain. So what happens if these areas get beat up? In the gut, this can happen from pathogenic foods, things that we shouldn't be eating, but we're putting into our diet, so like inflammatory foods, or we get little bugs that can cross into our gut and cause these types of issues as well. But what it leads to is a disruption in the tight junctions. And what happens is larger molecules and proteins start to make their way into the bloodstream, and then our immune system kind of goes into surveillance mode. So everything's kind of cool, calm, and collected. And then all of a sudden, this big, ugly critter comes into the bloodstream. So then the immune system's like, what in the heck is that? I got to go figure this out. I'm going to attack it and kill it. But if that happens a lot, then we start to have ramified immune responses, which basically just means that these immune responses become perpetual and they keep going and going and going. So we can have autoimmune reactions or just constant inflammatory responses. So that's a loss of tight junction integrity in the gut. And then up here, you can see infiltration, breakdown of blood-brain barrier. And then eventually you start to lose this tight junction integrity. Nasty little critters get in and you have like a breakdown of the blood-brain barrier. So similar, but a little bit different. So why am I telling you all this? Well, because the gut and the brain are constantly communicating with each other. We have communication from the gut to the brain, and we have communication from the brain to the gut. There's different ways that the brain and the gut communicate. From the gut to the brain, there's production of what are called neuropeptides that send signals and communicate all the way up to the brain. We have activation of immune cells, which will send signals up to the brain. We also have production of microbes that'll send some signals up to the brain. And then something that we're going to talk about in depth are what's called afferent vagal signaling. We have this huge nerve in our system. It's our 10th cranial nerve. It's called the vagus nerve. And the majority of the fibers of the vagus nerve, they're spread all throughout our body. And it's really an important nerve for resting and digesting, but it's also really important for communication. And it kind of like can survey the scene and send tons of signals up to our brain from our body. And the research shows that the majority of the fibers of this specific nerve are sending signals from the gut to the brain to kind of tell it what to do. So that's gut to brain, with a big focus for us tonight on vagus nerve. And then brain to gut. So we have the front part of the brain communicating with different areas inside the brain, which are like the insular cortex and the anterior cingulate gyrus, which you don't necessarily need to know too much of. But it'll also talk to what are called the vagus centers. So the pons and the medulla are areas of our brainstem that are very much lower in the brainstem, right above our spinal cord. And the vagus nerve, basically you could think of it as like the computer processing center of the vagus nerve, is right in that area. And it'll send signals from the brain to the rest of the body. So those are called efferent. So afferent means going to the brain, efferent means going from the brain to the rest of the body. So there's lots of ways that they can communicate. But the big focus for us tonight, it'll be on vagus nerve. And the reason is because when I was, trying to figure out why that young girl wasn't able to eat food, I started thinking of the neurology of it. She'd tried tons of nutritional protocols, functional medicine protocols, medication protocols, and nothing was really working. So I started to ask myself, what's the connection between the brain and the gut? And what can happen in a traumatic brain injury to the gut or to the brain? And what I found in the research was that this made a lot of sense to me, that anytime there's an injury to the brain, there can be disruption in the blood-brain barrier. So if there's a knock on the door, there can be a tear in the screened-in porch, right? So if someone's pounding down the door or hitting the screen hard enough, eventually something's going to break down. And that's what happens in a brain injury, is you get loss of that tight junction integrity, and you start to have dysfunction in the blood-brain barrier. So from the brain, that kind of made sense to me. And then this was really cool. So these little studies I'm showing you, these are in mice, but this group back in 2009, I believe, what they did was, unfortunately for the mice, they created a traumatic brain injury in one group of mice, and then in the other group, they kind of left alone. So in A here, you see a traumatic brain injured mouse, and then here's a normal mouse. And then what they did was they looked at samples of the tight junctions in those mice a few hours after the brain was injured. And what they found was that in a brain injured mouse, there was loss of tight junction integrity. So you don't have to know too much about science to see that there's a difference between these two pictures. This picture here looks fuller and tighter. This picture, the little cells look a little bit broken down. So there's normal tight junction integrity in a healthy mouse brain. And then in a traumatic brain injury mouse brain, it's all beat up. It's all broken down. So I started to realize that, hey, we're going to have breakdown in the barriers, not just the brain barriers, but also the gut barriers if the brain's affected. So then the question was, well, when the barriers are broken down, what happens next? And this is a cool little research paper that talks about kind of the neuroimmune side of things. And what it says is that after a primary injury, you get priming of microglial cells. So these are inflammatory cells that are going to go out and survey the scene. And what they do is sometimes they're really important because they kind of help go clean up. But over time, if they don't get turned off, then they can cause a whole host of problems within our brain and our body. So anyways, you have a primary injury, and then these inflammatory cells, they go to work. But what also happens is that there's structural and functional damage to the gut tissue, which we saw in that last picture. You have loss of that tight junction integrity. that loss of tight junction integrity will increase what's called intestinal permeability. So now you have an open screened-in porch for all these little bugs to get in. That's going to actually alter the microbiome. So that's going to change the health of your gut. So it's going to alter what's called the microbiome. And a diverse microbiome is extremely important for our health. The more diverse our microbiome is, the more healthy we are. And the research shows that there's a loss of microbiome diversity in traumatic brain injury. So when you have infiltration of immune cells, you have structural and functional changes to the cell lining, you have loss of tight junction integrity and intestinal permeability, you begin to get what's called systemic immune responses. So the whole body kind of starts to become a little bit inflamed from this head injury. These pro-inflammatory cytokines elicited from the gut will start to make their way back up to the brain. And because there's a loss of that blood-brain barrier integrity, you can get what's called persistent neuroinflammation. So initially you have this brain issue, right? But over time, things should get better if the system's balanced out. However, if there's structural and functional changes to the gut, then you can have these systemic immune responses, which then go back up to the brain and cause more problems because you've lost that integrity. There's no one guarding the door. The screened-in porch is open and the flies are getting in, both in the brain and in the gut. I hope that makes sense. But this is the connection. This is why looking at the gut and the brain after a brain injury is so important. And what I would say to this is that sometimes just taking nutritional supplements to dampen the inflammation may not be giving you the most bang for your buck, because the goal should also be to be able to support the barrier systems, help heal the barrier systems, and help kind of glue those barrier systems back together. So what can we do if we have loss of integrity in our barrier systems after a brain injury? Well, what the research says is we should really look at this nerve, this vagus nerve. There are other nerves that the research has shown to help with this, but the vagus nerve has such an impact because it has such a far reach. It's kind of got its tentacles and nerve fibers all over the place. So what the research shows is that vagal nerve stimulation can help decrease blood-brain barrier disruption after traumatic brain injury. There's different types of vagus nerve stimulation, exercises, and devices. What I'm going to be talking about tonight is transcutaneous vagus nerve stimulation, which is the most applicable at home or in the clinical setting. But back in the day, when I was working in the hospital, another reason I was kind of interested in this is because I saw that they were using implantable vagus nerve stimulators, which is a major surgery. Some would say it's not major, but it's a surgery. It's a big surgery. And those devices can sometimes fail. Sometimes those devices can become infected. So they can be very beneficial for the patient, but there's also a lot of risk involved with those. Looking at ways to stimulate the vagus nerve without surgery is actually one of the coolest things, because it's something we can do at home. Like I said, it's something you can easily do in the clinic with your practitioner, and it's something that can kind of be added on to nutritional supplementation. So we know that vagus nerve stimulation can help support the barrier systems. That's important. Specifically, this paper talked about the blood-brain barrier. But what was cool was that first paper that I showed you, where those traumatic brain injury mice, they lost the integrity of their intestines. That research group kind of got back together and they said, okay, here's a good question. What if these mice had just a little bit better what's called vagal tone? And what I mean by vagal tone is that the vagus nerve is just working a lot better. It's kind of more in tune and more in line. So what they did with this group of mice was they took obviously kind of just a control group, so just your normal average Joe mouse just hanging out. Then they also took the traumatic brain injured mouse and looked at their gut lining. So normal looks good. Like we saw earlier, after a traumatic brain injury, it beats up the guts a little bit. But what they found in this paper was that the mice who had better vagal tone, so the mice that had vagus stimulation before they received the brain injury, their intestinal lining, it didn't lose its integrity. So the tight junctions remained intact. So what this means is that vagus nerve stimulation can actually make you more resilient if a brain injury occurs. Not only can it help with healing, but it can also make us more resilient, so that if we do get hit, we're at less risk for these bad things happening within our system. What was also cool was they measured inflammatory markers. Specifically, this one was called intestinal TNF alpha. So this is called tumor necrosis factor alpha. It's one of the inflammatory markers. But what they found was that hours past TBI in the traumatic brain injured mouse, the markers went up. And this specific marker isn't a great one that you don't necessarily want this one to go up too high, because it means that there's immune issues going on. With the mouse that had vagus nerve stimulation, it kind of just chilled out. So you didn't have this huge immune response afterwards, and it stayed leveled. It kind of just chilled out the whole way. So what that said too is that, hey, vagus nerve stimulation can actually help dampen immune responses that are unwanted. So that's pretty cool. So going back to that one paper I showed you where we had the connection between the brain and the gut, I just wanted to show you this because what this paper talked about was that the gut-brain axis, it may very well be a therapeutic target to reduce the risk of what's called CTE, chronic traumatic encephalopathy, and other neurodegenerative diseases following a TBI. And not to say that everybody that has a concussion or a TBI is going to get CTE or neurodegenerative diseases, but if those immune responses aren't tamed and aren't calmed down, it does put you more at risk for developing these protein-based disorders within the brain. So then the question is I know this is a functional medicine talk and we'll talk a little bit about nutrition, but how could we support nutrition? So how can we basically get better bang for our buck if we're taking nutrition? And what I found for traumatic brain injury patients was that figuring out ways to stimulate the vagus nerve did that. So the majority of therapy that I'll be discussing in the next 5 minutes, it'll be talking about activating the vagus nerve just due to its wide distribution. So this is a little artistic drawing someone did that I pulled off Pinterest, but I just thought it was nice. And the fibers reach way further than you can see here, but you can see it's a pretty big nerve. There are really some simple ways to stimulate the vagus nerve. Some of the simplest ways, and some of these may sound really silly, it just includes doing deep belly breaths, getting involved with meditation and or mindfulness practices can really help stimulate the vagus nerve. And I won't go into too much detail on how it works, but if we're talking about deep belly breathing, doing slow counting breaths in and out can help. So what I recommend for patients is a slow 4 count in through your nose and then a slow 8 count out through your mouth. And you're making your belly button push out and in. So those are belly breaths. And the way I imagine that to work anatomically is that you're descending the diaphragm, and that's kind of like pulling on the vagus nerve fibers to try to wake up the vagus nerve and then slowly bringing it back up. It's doing tons of other things, but just to kind of give you a visual of what's happening with that. But those slow, purposeful, conscious breaths can help stimulate the vagus nerve, just something like that. And if you think about it, you never really have to think about breathing, but when you think about breathing, you kind of really have to think about it. It's something weird to think about. Like sitting there trying to count your breaths, it's weird, but you're breathing the whole time throughout the day. So it's just, that's always been something that's weird to me, but it's a very good conscious practice to do to stimulate the vagus nerve. And clinically, there are some really cool ways too. So if you do go to visit Dr. Schmo or other practitioners that do functional medicine and functional neurology around town, they can do things like this. And before I show you those therapies, just a reminder, like, why would we want to do this stimulation to this brainstem area? Because what I'm going to show you is sometimes we'll do stimulation to the face or to other areas of the body with a goal of kind of, if you can think about it, like lighting up the brainstem, trying to wake it up a little bit. And that's because the vagus nerve nuclei sit at the base of the brainstem, kind of right in here. And I'm talking a lot about vagus, but another great nerve, just as a side note, the trigeminal nerve has a big sensory nucleus involved with the face. And there's a lot of research that shows that trigeminal nerve stimulation in different forms and fashion can really stimulate the pons. And that kind of can have an overflow effect to the lower brainstem areas and affect the vagus nerve. So why would we want to do it? Well, we want to increase cerebral blood flow. We also want to help reduce pain in patients. I think pain is one of the most common things I see in different forms and fashions in brain injury patients. We want to increase tight junction integrity in both the gut and the brain. We want to reduce stress. Stress is a silent killer. We want to decrease inflammation. We want to help modulate brain function in a positive way. And we really want to increase that BBB integrity, the blood-brain barrier integrity. So I read this paper. It was pretty cool. It doesn't necessarily talk about brain injury patients, but it talks about inflammation. And it talked about vagus nerve stimulation for inflammation. And I won't read it all in detail, but what they did was they took patients that suffer from rheumatoid arthritis, which is an autoimmune disorder, and they did a simple stimulation to the external ear, which is an area of the ear that's innervated by the vagus nerve. And they found that it significantly reduced inflammatory responses in the rheumatoid patients. So even rheumatoid patients can benefit from vagus nerve stimulation. Lots of patients can benefit from vagus nerve stimulation. But I just thought this was a cool study because when you talk about vagus nerve stimulation and the brain and the gut, then we can't really talk about that without talking about immune responses. And again, those immune responses are important, but if they're prolonged or proliferated, they can cause systemic issues. So that's just a cool little paper on that. So there's lots of ways to do it. This is an actual medical device that's stimulating the branch of the vagus nerve that is in the neck area. Your average TENS unit, you can have an ear clip for your TENS unit that you put on to the TENS unit, and that can stimulate the vagus nerve. And then you can also just use a TENS pad to try to stimulate a little bit of vagus and a little bit of the trigeminal nerve. These I would not recommend doing unless it's under the supervision of a provider and making sure that the provider is giving you good prescriptions on how to do these exercises. It's not just something I would pick up and do at home. But like that paper I showed you earlier, if we're thinking really silly and simple, they had this little vibration device for the ear right here. You could go and, hey, just say, you know what, I'm at home. Maybe this could help me, right? I'll take a vibrating toothbrush and put it on this area of my ear. Obviously, what they did in the research paper is more specific, and that's not to say, oh, they could have just taken a toothbrush, but vibration on the outer ear, light vibration on the outer ear can really help stimulate the vagus nerve. If you're familiar, if your practitioner has low-level laser therapy, they can actually use that on different areas to stimulate the vagus nerve. Low-level laser therapy has lots of different benefits. It's just something that you'd have to talk to your functional medicine or functional neurological provider about. But going back to that one patient I told you about earlier in the talk, I called them belly rubs. So, you know, my thought, massage has such a great impact on the body and the brain that if we did mechanical massage to try to increase some motion in the gut and try to stimulate the vagus nerve, that could possibly help. So instead of just focusing on the brainstem and the brain areas, why not take kind of like a bottom-up approach? So looking at where the vagus nerve goes and providing stimulation there as well. So we would do things like belly rubs, some laser therapy on the gut, also some vibrational therapy, something as simple as this little Home Medics hand massager, just in nice circular slow patterns on the gut can help stimulate the vagus nerve. Some other real simple ways to stimulate the vagus nerve that I didn't talk about: singing in the shower. Your spouse will love you for that. Gargling loud and proud actually helps activate the posterior muscles in the back of your throat, and it'll help wake up those brainstem areas of the vagus nerve and then help get the brain and the vagus nerve kind of back in line. Cold shower. That's really not that fun usually, but you can also just take cold water and kind of splash it on your face. Those are other simple ways to stimulate the vagus nerve. But brainstem stimulation is important regarding the barrier systems because healthy brainstem activity allows for the brain to work. When the brain becomes offline in a brain injury, sometimes the brainstem is working overtime, and the more we can get the big brain back in line, the brainstem can kind of chill out and work in the background like it's supposed to. There's lots of important areas in the brainstem, like the vagus nerve nuclei and the trigeminal nerve and its nucleus. And it plays a lot of roles in help balancing out the system and really creating a healthy immune system. So just to recap on that, in a brain injury, there can be gut dysfunction even though the gut wasn't touched, right? And that's because there's different communication pathways between the brain and the gut. One big one is the vagus nerve. So looking at those barrier systems and trying to make sure that you have healthy barrier systems can be really important for benefiting the most from your nutritional supplements. So just to wrap this up, this is a paper written, I think in 2017, by a functional medicine provider, and she wrote the functional medicine approach to traumatic brain injury. So she talks a lot about integrative care in the paper, but kind of just to show you some nutritional supplementation, some things that can help with the inflammatory response, things that can help with the barrier systems, are some of these nutritional supplements that are listed here. Another important thing to kind of think about is not just like putting in good stuff to your system, but also trying to remove the bad things. And some of the most common allergens that are not good for really any of us are wheat. So removing gluten from our diet can really help set the stage for healing when you've suffered a traumatic brain injury, because wheat is a difficult protein to digest, especially when the intestinal mucosa have been affected by a brain injury. So removing wheat from our diet, removing milk from our diet. So cow's milk has a protein called casein in it. That's a large, difficult to digest protein that can cause inflammatory responses. So those are like the big two in my book. If you can just start there by removing some things and then adding in some other things to help support the systems, then you're on the right track. And I know this isn't super duper specific and it doesn't give you any protocols, but I think just knowing that the barrier systems is a thing and knowing that the gut-brain axis is a thing as well, and it does exist, then you can understand ways to begin the healing process. So outside of doing some of the things we talked about, I didn't talk about hyperbaric oxygen therapy, but that's something that can be great. Acupuncture, acupressure can help. Music therapy, mindfulness-based cognitive therapy, and then nutritional stuff, which is why we're all here, because we're talking about functional medicine. But nutritional supplementation such as choline can help with the inflammatory response. Coenzyme Q10, it can help with mitochondrial issues that develop from inflammatory responses and help recovery from TBI. This one's pretty cool. Curcumin, there's evidence that shows that it can help with blood-brain barrier integrity. Blood-brain barrier integrity right there. Glutathione. Glutathione is it's like the big good, not big bad, but the big good super duper antioxidant within our system. And when you have inflammation, you have what are called free radicals kind of floating around, and something needs to go survey the land and clean those out. And that's what glutathione does. So glutathione is a great supplement to add into your functional medicine protocol to help with the healing process of TBI. Magnesium. Magnesium can become depleted in TBI, and magnesium and different isotopes of magnesium can become can be neuroprotective. One of the newer ones, it's called magnesium threonate. It can help with, it can kind of help get across the blood-brain barrier to help the healing process in the brain. So that's a pretty cool one. And then obviously, you know, with vitamin D deficiency, and if you're talking about inflammation, if you have a deficiency in vitamin D, that can become increased. So you can have an increased deficiency in vitamin D from a traumatic brain injury. So making sure that you get supplemental vitamin D through your diet and through nutrition is really important, because that can help dampen the immune response. So I won't read the whole list to you, but I just wanted everyone that's watching this to have the list in case you're interested. And that's pretty much all I have for you. I hope that, you know, my goal with this was just to kind of, again, have an idea of what the gut-brain axis is, and just to talk a little bit about what the vagus nerve is, what it does, how you can do some exercises for it, and then some of the nutritional stuff at the end. So thank you so much. I have a Facebook group called Brain Chat. It's a free page. I usually do a post a day on information. If you're ever interested in following us there or on Instagram, that'd be awesome. And you can always reach me through messages on the Brain Chat Facebook page. So thank you so much for your time, and I hope everyone's staying healthy and happy. Have a good one.